am Dr. Ravish, the Chief Urologist in RV Aster Hospital. Here I have my two anesthetists, the OT technician in charge and the OT nurse in charge. Dr. Subramanya is the Chief Anesthesiologist in RV Aster Hospital, and Dr. Deepak, who is a URO Anesthetist with me. Lava is the nursing in charge of the OT in RV Aster Hospital, and OT technician in charge is Shrikant. They are now taking up a patient of CA prostate, which has to be induced for robotic radical prostatectomy.
Welcome to Aster RV Hospital. My name is Dr. Subramanyam. I am the Chief of Anaesthesiology Services here. Anesthesia now has changed dramatically over the last few decades. In fact, it's the safest it has ever been in the human race now. Normally, people are afraid of anesthesia, but there is no reason to worry now because the advances which have happened have enabled us to provide anesthesia safely irrespective of the age or the amount of cardiac disease or other diseases what they have. Within our department, we have a team of talent here. We can look after patients from as young as just a newborn to somebody who is very old of 100+ years. Each anesthetist has been handpicked and they have been trained all over the world. We have subspecializations in anesthesia. We have our subspecialist anesthetist who looks after the URO anesthesia. Each patient, when they come to a hospital, we make a comprehensive plan for them. It starts from the time of arrival, wherein which we do pre-operative anesthetic assessment, plan an anesthesia, make sure that he is safe during the surgery. We plan his pain relief during the operation and after the operation. We have various advances which are happening in the field of anesthesia. We hope to be one of those hospitals wherein which we can call ourselves as no pain goes untreated. That is our motto. We have excellent form of analgesia nowadays. Sometimes we club what is known as an epidural analgesia along with general anesthesia to make sure patients are safe. We also have advanced patient-controlled analgesia pumps in which patient can have an absolute pain relief and he can be under the control of his because he will have a push button when to use it. We also have advanced ultrasound machines which can help us give appropriate nerve blocks to make sure the analgesia is the best possible what we can give here. Thank you.
Hello, I'm Dr. Deepak. I'm a senior consultant at Aster RV Hospital and I take care of anesthesia for Urological Services. We do various cases related to urology, right from TURPs, where we use laser TURP as one of the modalities. Then we do cases of renal transplantation. We are the licensed center for the renal transplant program in this part of the country, and we do specialize in radical robotic prostatectomies. So the challenges with the radical prostate surgery is wherein the patient is usually an adult who is past his young age with associated heart diseases, blood pressure, diabetes and associated age related problems. When they come for surgery, the problems has to be pre-assessed in the preoperative period, wherein we do extensive assessment of the physical condition of the patient, and also that we plan the anesthetic and explain the preoperative conditions and postoperative issues of the patient. We have a counseling team, we do all that. Once the patient is willing for surgery and we proceed with the appropriate management, we can handle any sort of cases or any sort of problems. We do cases wherein they have a very low ejection fraction to there could be many associated problems. We are equipped to deal with all of them at Aster RV Hospital. So we have an excellent team of surgeons who always do a good job, and then we try to match up to their excellence. Whenever a patient comes for radical prostate surgeries, with the use of the robotics in the radical prostate surgeries, the morbidity has definitely come down. But it provides challenges to the anesthesia also because of the duration of surgery that is involved, and as well as the positioning of the patient, wherein we may have to give a steep head down position for the patient during the surgery, and blood loss is very much minimal during these surgeries, but it still needs to be monitored with the use of intraoperative invasive blood pressure monitoring. Then we do have facility to provide targeted nerve blocks for controlling pain. Even if the patient is on clopidogrel, we don't really have to rely on epidurals, as we give truncal ultrasound guided nerve blocks, which provide excellent anesthesia and analgesia in the postoperative period. The hemodynamic stability can be monitored very well with the use of intraoperative indwelling catheters, arterial catheters, which measures the beat to beat variation of the heart, so that our therapy in treating any hypotension, blood loss is up to the supreme best. So in this thing, postoperatively also, the patient needs, few of the patients will need ICU care, which is very well available at our hospital at Aster RV.